Welcome to Engaging with Self-Ligation, a series of short modules where topics surrounding self-ligation will be discussed. My name is Dr. Lisa Alvitro, and I have 25 years of clinical experience and over 15 years using self-ligation. Today's topic will address Archwire activation in self-ligation. Joining me is Jennifer McWhinney with over 15 years of clinical experience. Controlling activation of the Archwire, and what do I mean by that? Well, I think a lot of times we're focusing on obviously our brackets, our bracket placement. We're focusing on which wire we're going to use, but what about how do we activate that wire? Because we have to remember that really the Archwire and the amount that we deflected, that becomes part of that force system. So we're always trying to figure out what system, what forces are we going to create. And that is one of the biggest advantages, I think, often overlooked, particularly, I think, in areas where there's a lot of delegation of tasks. And being able to control that activation, not only between different doctors that may be practicing together or different staff members. So we have to be able to control that activation of the Archwire. And, variations in the way the Archwire is engaged influence the force. And remember, it's the force that moves teeth. It's the force that affects the treatment. So in self-ligation, that activation is either through closing a door or securing it with clips. Closing a door like when we're using Ultra, or securing it with clips like in Smart Clip. So it's the standardization among all clinicians that helps produce a standardized force and a standardized treatment effect. One of the keys to efficiency in treatment is standardization. So you and I may choose the same Archwire. What if you don't tie it in like I tie it in? There's a big difference. Or what if there's even a difference, like one appointment I tie it in tightly, one appointment I don't. And so this standardization, I think, is really so it's just one of the amazing advantages of self-ligation. So, here, I think here's a nice example of that. What happens if you use a ligature tie? Do you ever see differences in ligature ties?
You do. Different colors sometimes even have different strengths or weaknesses. The way people put them on are different sometimes as well.
What about even when patients come back?
Sometimes they're off, but you can see on that slide the force is stronger, and sometimes that elastic tie will just come off. So then we have no movement on that tooth, or we've lost that movement that we should have had.
I think that's really important that, obviously when you take that tie off, it starts to stretch, and then you're trying to work it around the bracket, and then it may not hold the Archwire. I think this is a great example because, obviously it's a type and not with identical malocclusion, but you can see that Archwire is not completely engaged. You might think, well, does that really matter? Okay, let's look at the Archwire activation. Look at how much activation you'd see there. Look how much you see. That's about twice as much. And that deflection is what generates the force. So this tooth and this tooth will not move the same way. And, like Jennifer mentioned, this tends to create over time. And sometimes you'll think, oh, I've got it in. And then when the patient comes back, it maybe was overstretched, or it then fatigued, and the wire came out, or the entire elastic was lost. Now, one of the ways you can overcome the limitations of a lot, and I admit the colors are cute, and kids will say, what about colors? I want colors with my brackets. Well, eventually you're going to get colors when we're trying to add resistance. A module will talk about when you're going to want resistance. So yes, you will get your colors, but sometimes it can make teeth move faster without a color. But let's take a look at, okay, I could just steel tie something. Well, you can, and again, you can mimic that amount of deflection that you've seen in self-ligation. It's probably not identical because remember, you're not pushing against the slot. But then you've got all these little ties that you've got to tuck in between. And, do your patients ever have problems with those steel ties?
And sometimes they do when they go to floss. Sometimes it can bring those out, or sometimes if you don't get it properly tucked, it could poke your lip.
So, it's something that you can use to activate an Archwire, but again, I think it's very technique sensitive. Some staff members, or sometimes myself, I'm even better at one side than the other, depending if you're left or right-handed. And then obviously really increases chair time. So really, in our clinic, we prefer to be able to use self-ligation, because no matter if I slide this Archwire in, or a staff member slides the Archwire in, we all close the door, we all get the same amount of deflection, we should all get the same treatment response. Today's topic was Archwire activation and self-ligation. There are other topics that are available as part of this series.